Raymond Arroyo sitting in for Laura Ingraham. The National Journal today reporting Medicare hospital insurance, the fund will exhaust in 2024, 5 years sooner than expected. Social Security Trust Fund will expire in 2036, a year earlier than last projected. We're joined on the phone by Congressman Paul Ryan, the Wisconsin Republican and chairman of the House Budget Committee, and someone who has been very focused on this problem and attempting to make a difference. Congressman Ryan, thanks for joining us.
Hey, Beck, thanks for having me.
Hey, I want to play this little bite. I'm sure you heard it all weekend or since yesterday.
Yes, I've heard it a few times this morning already.
Well, this is Newt Gingrich. I want to share this with the audience and get your reaction.
I don't think right-wing social engineering is any more desirable than left-wing social engineering. I don't think imposing radical change from the right or the left is a very good way for a free society to operate.
Now, this is just after he supported your plan a few weeks ago. What do you make of this criticism?
You know, I just been, like I said this morning, with allies like that, who needs the left? You know?
Yeah.
Look, what's happening is Medicare is going broke, and we're saying if we put a plan like this in place, you don't have to change the benefits for anybody who's 55 and above. I mean, that's hardly radical. What's radical is the president's new law, which now he's doubling down on, saying he wants 15 people, unelected bureaucrats he will appoint next year, and put them in charge of Medicare, and they will decide how much to cut Medicare, what prices to control, what care to ration. We think that that's radical. And so what we're simply saying is for people who are 54 and below, when they become Medicare eligible, let them choose. Give them freedom to choose among a list of guaranteed coverage options offered to them by Medicare. Medicare has lots of experience doing this. And subsidize their care based upon who they are. More if they're poor and sick, less if they're wealthy. It's not a radical departure from what we've done. It's the same recommendation Bill Clinton's bipartisan Commission to Save Medicare recommended back in the late 90s. It's an idea that works just like the kind of system members of Congress and federal employees have. Medicare already does this in many ways with its prescription drug benefit, with its Medicare Advantage program. Seniors are used to having choices among supplemental insurance coverage plans offered through Medicare that are private plans that they can select from. What we're simply saying is don't give the power to a bureaucrat to ration care. Keep Medicare like it is for people in and near retirement, and give the power for future Medicare beneficiaries so that they can make the choices on what best plan meets their needs. Hardly is that social engineering and radical. What's radical is kicking the can down the road, not doing anything to fix this problem, and watching the whole system implode on itself, which the trustees just told us last week is coming sooner than we thought.